The recent FDA leaked memo has triggered eruptions and movements across the world because it highlighted that 10 out of 96 children that were submitted to the VAERS in the US could have died from vaccine injuries. And I think that this is something that is only going to grow because it raises questions about if the USA are now seeing that, what is the situation for other countries across the world? And I don't want to say I told you so, but I told you so from a number of years ago. And I'm going to show you two things. One is an interview, a short clip of an interview with Joe Rogan and Dr. Mary Talley-Bowden. And I'm going to show you a paper that I spoke about a long time ago. I'm looking at the date here. This is in my Substack, which is a record for me of the thoughts that I've had over the years. And this was a paper from Thailand. And this is 2022, 18th of August, 2022 was when I did that post. And it's worrying me in the sense that this is 3 years, 3.5 years down the line almost. And the implications of what I was talking about then are just starting to come to fruition. And so why I'm concerned is because some of the other things that I've looked at, certainly in context of what Garrett has said, I realize that sometimes timelines are very difficult to predict. But science, like everything else, follows a consistent path with regards to the outcomes. You can't change outcomes because of an opinion. The science is the science. So I'm going to play you this clip from
Don't worry about these kids.
and make sure you hear the sound. So if you can't hear it, please let me know. I'll be checking my my screen. And so listen to this with Dr. Mary Talley-Bowden, and then I'll come back and make some points, or I may make a few interruptions along the way. Let's hear what the conversation was about.
Kids, because myocarditis, the primary symptom is chest pain. But if you've got a kid who's not even speaking yet, you
I'll pause that right there because some people perceive what she said there as scaremongering, but she is right in the sense that once there is scarring on the heart from whatever cause, there is an increased risk that there is a problem. It seems that some people didn't hear the sound. I'm going to go back again because this is important. Let's try that again. Yes, some people can't hear the sound from that. So stop screen. Okay, let's just try again and see if this works. Okay, yeah, let's just get this ready, and I'll try this again. Let's see if you can hear what is happening. So let's try again and see if you can hear the interview.
don't worry about these kids because, myocarditis, the primary symptom is chest pain. But if you've got a kid who's not even speaking yet, you have no idea if they have myocarditis. And myocarditis can leave a permanent scar on the heart and then lead to a lifelong increased risk of sudden cardiac death.
So this is where I was pointing out, and I'm glad so people can hear this. She is right about the scarring. Once scarring occurs, there is an increased risk for arrhythmias, and arrhythmias can lead to sudden cardiac death. So when you think about it from a population level, Now, there are some children who may have had, say, a viral infection or some damage to their heart, and they already have an increased risk. But if you increase that risk across the population, what you will see down the line, and this could be 10, 20, 30 years down the line, increasing risk of arrhythmias with the associated complications. And this is why, at a population level, this can be so significant. Let's continue to hear what she had to say.
And we have no idea if these kids have been affected.
Yeah, and how many kids did we see drop dead of heart attacks in like high school football this year?
Right.
Like over the last 4 years, rather. It was like you'd see these articles pop up all the time. You never saw those articles. Or if you did, it was super rare, and it's some kid with a heart condition that was never diagnosed, which does happen.
Yeah, and the schools are now...
I'll pause that there again. Now, one of the challenges that people make when they hear people say about all these people who are dying and so on, one of the points that the challengers go against it is saying that you're hearing more about it because you are sensitized to it. So meaning that because you've heard that this happens, news stories are picking it up more. And so this is part of the reason why it is occurring. That may be true, and there is certainly some amount of truth to that. But what I think I am finding, and I was searching for this recently about a year ago, looking at those outcomes in terms of sudden cardiac death, there was no doubt it was rising in high schools in the USA, but worse yet, they weren't publishing the results. And I should go and look again and see if the results for 2024 had come in, but it was definitely a rise. And so this was not just an imagination. From the data, it was suggestive that this was happening more frequently. Let's continue to listen.
Making kids get cleared by a doctor before doing sports, which I don't remember that when we were kids.
Wow. Yeah, they just threw us right onto the wrestling team. They didn't check shit.
Right.
They didn't even see if you had a cold.
Right.
Yeah. I mean, I don't know what's better. It's probably better to screen them. You know, they'll find those undiagnosed conditions that kids can have.
Well, I think it's in response to what's happened.
Oh,
yeah,
it certainly is. But I mean, that might be the good aspect of it.
Right.
Maybe some people will get diagnosed that didn't have any idea that they were running around with the problem, and they can fix it.
But it's hard to diagnose. Like, really, the only way you can diagnose myocarditis for sure is to do either a biopsy or a cardiac MRI, which is, most kids are not going to be put through that.
Right.
So
Jesus.
It's scary.
And it's what's crazy is this is all true, and yet us talking about it makes us both look like kooks. Like, we then will be labeled, for sure, someone will go out and attack us now and label us anti-vax, anti-science, kooks, and this is what's dangerous about this conversation. This is what's dangerous about what they said. And, those people work for the devil.
Well, do you think you'll get censored on YouTube, this interview?
No.
You don't?
No.
Because I was just on Jimmy Dore.
Yeah, and you got censored?
I'll pause them there, but that's the essence of what they had been talking about. And he's right when he says that this kind of information is labeled as anti-science, anti-vax, and so on. I think that from my perspective, when I think about it, because it is easier to just ignore it, because you do get targeted because you talk about these things. But I think that there is a responsibility to look objectively at what is happening and to try and understand and predict what could happen, because it is relevant to public health. And I think genuinely that any organization that is not having this at top and center of their agenda is not acting in the interest of the public. And actually, they are not acting in the interests of themselves, because in time, those organizations that remain silent will lose the credibility of the public, because they didn't try, they didn't even look, they didn't ask any questions. So this is pretty serious stuff. Now, let's come back to what the data was showing us. And some people don't understand why I was always asking the question specifically in relation to children. Now, it's important to note that when the vaccines came out, I wasn't against using the vaccines, even though I had concerns about autoimmune responses. I recognized that people who were high risk and who had no options. So it's not because there was nothing that couldn't be done. You know, Dr. Chetty could have probably saved all of them, but they were silencing that. They didn't have any options. So for those high risk people, you're better to intervene with something that could reduce the risk of severe COVID, which the vaccine did. But from a scientific point of view, I could not understand going down to low risk cohorts. And I'm talking about low risk adults here. Children weren't even on the agenda. Now, what I will say very clearly, in case anybody from industry, pharmaceutical industry, is listening, this was clearly a gamble, because you had a low risk cohort who really didn't die from severe COVID. They may have had other side effects. You know, it's not that they didn't have any side effects, but it is usually children who had some kind of comorbidity. So even if you were going to vaccinate children and you were going to focus on only those with comorbidities, you could argue about that. But they were positioning themselves where if this went wrong, the outcomes would be horrific. It was a gamble. And for the life of me, I do not understand what made industry take that gamble. Was it financial? Was it that they saw the financial gains in the short term? Was it that they believed the science would be perfect? I have no idea. But it was going to be the biggest risk that was in front of them. Now, you can understand that they thought about it in late 2021 and they were toying with it in early 2022. But by the time you started to see papers like this come out, and this was in August, published 19th of August, 2022, and it was from Thailand. I don't know if they can say that they ignored it because of that, but they were looking at the cardiovascular manifestations of children aged 13 to 18 from 2 schools. So it wasn't a big sample. And effectively, they found a cohort leaving about 301 participants for analysis. So they vaccinated them 2 doses, and they did critical things. They did the data, demographics, symptoms, vital signs, ECG, echocardiography, and the cardiac enzymes were collected at baseline. Then they checked at day 3, day 7, and day 14 in some cases. So this was in a short time frame after the children had been vaccinated. And this wasn't even as robust as the Big Ten study that they did for COVID infection, where they did a cardiac MRI as well. But that was good enough to indicate that you were at least trying to look for problems. Okay? So when you looked at that cohort of 300 children, you then saw that the most common cardiovascular issues were tachycardia, 7.64%, shortness of breath, palpitations, chest pain, and hypertension. If this is not a red flag, you know, that, okay, even if they didn't die, what the heck is going on? Why did this occur? Now, even worse, 7 of the participants exhibited at least one elevated cardiac biomarker or lab positive test. So the cardiovascular manifestations were found in 29, almost 30% of the children, ranging from tachycardia, fast heart rate, palpitations, to myopericarditis. 30%. Even though it was a small cohort, even if you pulled it down to 15%, what in the world were they thinking? I mean, so when you say now that if you had a cohort of 96 children who were submitted to VAERS for vaccine-associated adverse died, high probability related to the vaccine, and you look at a study like this that was done in 2022, that showed that 30% were having some issue. Now, you could argue that the tachycardia was that they had a temperature or something, but this is not what they found, and you have to look. Let's again take out all the other symptoms and look at this just here. 2 of the patients had suspected pericarditis. 4 had suspected subclinical myocarditis. 6 of those children had, out of 300, had some significant cardiac related issue. Remember, this was published on 19th of August 2022. I spoke about it at that time. Vaccine-induced heart inflammation in 1 of every 43 children. That's technically what it showed. Now, as I said, how in the world could that flag be overlooked? And this is the problem they're facing now, because this FDA move to publish, hopefully, the data on the 10 children, I want them to publish it on the 96 children, because I suspect that the number is going to be much higher than 10 of the 96, because the rule is simple. If a child died within a temporally, meaning that within a close time frame to being vaccinated, so say within 28 days, and they had no other comorbidity, nothing else was wrong, I cannot think of a good reason why you wouldn't link it to the vaccine. You'd have to find something else, because it is possible maybe they had an infection or something, but you would have to find evidence of that for you to conclusively say it wasn't the vaccine. This is the problem, is that some people want to say that you have to prove it was. No. I would say if there is no other clear cause, you have to prove it wasn't. That's the way that I would look at it from a clinical perspective. So what we're facing here is a significant wake-up call, because as she said, myocarditis can cause long-term scarring of the heart. A scar on the heart doesn't disappear. No matter how young you are, that scar is going to stay, and that scar increases that risk. And so if we think about, let's give the best case scenario. 4 out of every 300 children. All right, let's make it even better than that. So out of 300 children, we say that only, they found 4 patients had suspected subclinical myocarditis with the cardiac enzymes. Let's make it 1 patient in 300 had myocarditis. That is an absolutely huge population impact, because the implications will present down the line. They won't actually be right now. And that is the big concern, because it's when the heart is put under pressure that you may find these abnormal patterns occurring. This is so significant that you may have to give instructions to people down the line, kind of like what they were doing, that they have to screen them before they do any very active sports. But you also have to tell them, please don't use drugs. Because if you use some of these drugs that trigger palpitations and arrhythmias anyway, cocaine, heroin, maybe not as much cannabis, or even alcohol, you don't want them drinking either. Did they realize that could be the long-term position? You cannot do those things, because it would be too high risk if you had 1 in 300 people as an adult at risk for this kind of problem. That's a nightmare. And this is what we're facing now. And nobody is likely to try and make any difference to it. That's the sad part. It is now one of those topics that is off the agenda. The FDA may bring it back, but sadly, even if they do, what do you do about it? So whichever way we take it, I am encouraging everyone to participate in becoming part of the solution, not just observe the problem. And that's why if you look in the description, I've put together a STAN community. And what we're doing, or what I'm planning to do, is educate people so that you can help to identify people who have issues, guide them, advocate for them, so that they may, hopefully in the long run, be more protected. That's now a responsibility. Now that you've heard this becomes a responsibility. You can't just stand on the sidelines and criticize. You need to come forward. You need to try and see if you can understand, and you need to see if you can help those around you. This is especially important for the unvaccinated who don't have any long-term issues. You really have a responsibility here. That's the encouragement. So I'll continue to explore the future. There are lots of challenges ahead, but I believe that with the right knowledge, the right approach, everybody can be part of the solution. Have a great evening.
A hero, an immune adventure. Humming Heroes, your lyrical guide to the body's defenders. Now on Amazon. Check the links below.